Hey everyone, if you've seen our last couple of videos, then this view behind us is probably a little familiar to you. And while we said in our last video we were hoping to get out in the next couple days, unfortunately, that's not the case. We are still at my parents' house in Fort Wayne, Indiana, and that's because just before we were actually going to leave, Ro had a doctor's appointment with a general practitioner that she just, brand new one.
Yep, brand new.
Yeah, so he did a whole bunch of, just checking all the stuff, routine exam and all that stuff.
Like that meet and greet appointment or whatever.
Yeah, and Ro informed him of, any, just
all my
concerns,
all my health stuff, and
you guys may remember that Ro's got various, heart conditions going on, some gastrointestinal stuff, and so
I've got a cyst on my leg.
Yeah,
and so all kinds of stuff.
Yeah, she told him about all that stuff, and he was like, "Okay, we need to get that taken care of." And there was also during that routine exam something pretty serious actually was found, potentially serious.
Potentially.
Could be nothing, potentially serious. And that's as specific as we're going to get on that health aspect, just because, sometimes you want to keep that private.
Yeah.
But so because that potentially serious thing was found, he was like, look, we need to get this figured out immediately.
Yeah.
And so Ro made an appointment to get that figured out. And unfortunately, the nearest appointment, or the soonest one they could get, was just over a week. And so...
Well, first it was a month out, and then I got a call back today that they could get me in sooner, and that might not be the only appointment to get stuff figured out, so we don't know how long we're staying now.
Yeah, so we're stuck until at least we can get the serious thing checked out. But because of all of this healthcare stuff that's going on now, that we didn't really expect actually, we didn't expect it at all.
No.
We thought we were just going in for just a general visit, a meet and greet with a new general practitioner. Because of all this that has now come up, we figured, we would cover a really important topic to a lot of you guys, and especially to prospective full-time RVers, and that is health insurance and healthcare on the road. Now, we may be talking human healthcare in this video, but something you want to make sure that you don't neglect is the health of your RV, and this video's sponsor, 3-in-1's RVcare Rubber Seal Conditioner, will help you do that. 3-in-1 RVcare Rubber Seal Conditioner is specifically designed to condition and protect all types of RV rubber seals, including those on slide-outs, doors, windows, and compartments. Its long-lasting, water-resistant formula reduces friction and wear. Its special UV shields prevents cracking and fading and can help extend the life of your seals. We use 3-in-1's Rubber Seal Conditioner on our window and door seals regularly, and if you're going to be storing your RV for the winter, it's important that you do this before storing it so that it will protect it all winter. And it's really easy to use. You just spray it right directly on the seal, and then with a paper towel or any sort of cloth, you just wipe it around. And just like that, your seals are protected from the elements. Now back to healthcare.
A major downside to being a full-time RVer and medical coverage is that when you first sign up for a medical coverage policy, it covers you in the state that you sign up or the state that you live. And as a full-time RVer that travels the country, if you have to have any routine medical procedures done, you have to do that in the state in which your insurance covers. And sure, like our insurance, most emergencies, if you're out of state, are covered just like as if they were happening in the state that your insurance normally covers. So for David and I, because we're really healthy, our motto has always been, we're just gonna have, the basic insurance that will cover us out of state for emergencies. Like if one of us breaks our leg and we have to go to the ER or, something like that, then we know at least we're still covered. But for things like what we're dealing with right now, where we had to be home for some doctor's appointments, we had to make sure that everything that we wanted to get looked at was going to happen while we're here. What are you doing? What are you doing? And because we had to do a whole bunch of doctor's appointments while we're here and other things have turned up, now we have to stay longer. And while traveling to other places and coming back is feasible, it's not necessarily something that the two of us want to do. So we're just gonna hang out for now But for those of you that are maybe a little bit older, or you have things like prescriptions that you have to do every day, or I'm sorry, every month, or multiple times a month that you have to get filled, it can be a big pain getting your prescriptions on the road. Luckily, David and I don't have any prescriptions currently that we have to pick up on the road, and I know that there are some controlled substance type prescriptions out there where you have to see a doctor once a month and you have to get it filled in person. And doing something like that while traveling full-time, especially out of the state that you're covered in, is going to be really, really difficult. So we're already having a slightly difficult, annoying time with healthcare coverage, and for those of you that have, you know, larger healthcare needs than we do, or prescriptions, it's going to be an even bigger pain getting medical coverage on the road.
Now, the insurance plan that we have is what I usually call a catastrophic healthcare plan, and basically what that means is the only reason we have it is to protect us from going bankrupt if a very serious thing happens where we need to be in the hospital for an extended period of time. So it basically covers nothing or very little. It just protects us by having an out-of-pocket maximum for the year. And here are the stats on the plan. It is a private insurance plan because we are self-employed, so we don't have any type of employer-sponsored health care. We are not on an insurance plan through the health insurance marketplace either. And how we found our plan is I just got onto the websites of the various, big name insurance companies that are nationwide, and I just searched through their websites, and they were able to give me insurance quotes for various types of coverage. And our premium for both Ro and I is thankfully very low. It's only $91 or so a month. And one of the ways I was able to get it so low is we paid upfront for the entire term of our health insurance plan. And that actually saved us about 25% of the cost. So it was like, okay, if we just pony up all the money up front, we're going to save a lot of money. So if you're also going to be looking into a private health insurance plan, then being able to pay everything up front is going to save you a lot of money. But like I said, our plan doesn't really cover much, and here are the stats on it. We do have copay for urgent care, but it's $75, and our ER copay is $250. The out-of-pocket maximum for the year for coinsurance is $10,000, which is a lot, and our coinsurance percent is 60/40. And the deductible for an individual, this is one of the parts where this is not a very good plan, is $12,500. And that's for an individual. That's me and Ro separately. And it doesn't have any coverage for prescriptions. So again, we got this coverage, or this health insurance plan, because we're both relatively healthy, we're very young, so and none of us have any ongoing procedures that we need to do or have done, and neither of us have any ongoing expensive prescriptions that we need coverage for.
I want to give you guys a couple of examples as to why our current catastrophic health coverage may not be what is going to be right for us in the upcoming year of 2021. And we haven't talked too much about my medical problems or anything because they're really not terrible right now or anything like that, so we haven't brought them up, but I want to explain to you guys a couple of things that I've got going on and the different types of specialists that I'm going to have to be seeing in 2021, which is why we're going to be hopefully catering our insurance when open enrollment starts in November to potentially having to get certain procedures done. I'm going to start with my heart. And when I was a little kid, I had something called rheumatic fever. And you guys can look it up. I'm not going to give you all the details of what it is, but because of that, I have rheumatic heart disease. And my heart will slowly enlarge over time, and that will create problems in the future as I get older. But right now, it's no big deal. There's nothing they can really do about it. I can be prescribed some medications to help arrhythmias and stuff like that. Okay, you can leave. So I have a cardiologist appointment set up for this coming year in early January to set up with a new cardiologist because my old one isn't practicing anymore, and I'm just going to be going to them because there's a new thing happening that they're going to be checking out. I don't think any procedures are going to happen. I think that what is probably going to end up happening is they're just going to prescribe me on some new medication, which in the future, that's going to be a little frustrating with us traveling a lot and having to get that on the road. So we'll see how that goes. Something else that I'm going to need to get looked at the very beginning of this next year is I've been having some stomach issues. A lot of you guys have been aware of this because it's not something we've really kept quiet about because we're really confused by it. I've never had any procedures done, and I'm already aware that something that they're going to do is they're going to put me under and they're going to scope my stomach to see what's happening in there and see if they can figure out just with that one simple procedure what's happening and go from there. So I know that's going to happen. I'm going to have to go and see a gastroenterologist for that. I have a cyst on my leg that I've had for as long as I can remember. I remember as a little girl learning how to shave my legs and coming across it and it hurting a little bit, seeing a doctor about it when I was a teenager, her saying, it's no big deal, don't worry about it. If it starts hurting, they'll come back and see me. Well, it's been hurting for a couple years now, and my general practitioner, my new doctor, he has said that he wants to get that removed pretty quickly as well because it is bothering me, but it's not something that's critical and he's not really worried about it or anything, so that is also being pushed off until early January when we can switch our insurance over. Now, we don't want to go into any details really about what is happening currently, but next week I have an imaging appointment to figure out what this new thing my doctor has found is all about. And hopefully we can get some answers on that, but that is going to be covered under our current insurance, and because our current insurance doesn't really cover anything, we're going to end up having to pay out of pocket for anything that needs to happen between now and December. Now, I really don't want any of you guys to worry because the medical procedure or the medical thing that's going on with me that I'm not willing to share right now isn't because it's super crazy serious. It's serious enough that we need to stay to get some things figured out, but it's not dire or anything. And if, information comes out that it is something that is serious, we'll let you guys know. We don't, we see you guys as family. A lot of you have followed our journeys here traveling on the road for years. And so if we have any bad news for you guys, we will be sharing that with you. But as of right now, we just don't know anything.
And we'll also let you know if it's nothing.
Yeah,
also,
if it's nothing
when the results come in and it's nothing also.
Yeah.
But that is it for this video, all about our healthcare and our health insurance as full-time RVers. Hopefully sharing, what we have and our plans and all that stuff is helpful for you guys, because I know that this is a very big question and people ask us all the time about our health insurance. Mm-hmm. It's just a big topic in general. But that's all for us in this video. We'll see you guys next time. Bye. It's Sweet Pea. Ooh. Sweet Pea. You want to say bye? Oh my Sweet goodness. Pea.
So excited she wants to run off the bed.
I know.
Oh,
all right, get out of here. Whoa.